Good morning. I want to welcome you to our press briefing with updates on COVID-19. As of this morning, we have lost over 180 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we'll hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. I want to talk about two issues this morning. The first is the availability of antibody testing. Most members of the public will remember that the city, county, and school board contracted with Augusta University to come down to Albany to conduct antibody testing. Unfortunately, the turnout for the antibody testing, which is free, has been quite disappointing. The chief advises me, as of yesterday, only 562 citizens have been tested. Let me say this. Only residents of Dougherty County are eligible for the antibody testing. But again, there is no charge. Why would I need the antibody test? Well, we have some information. What is the antibody? The antibody is something the body creates to help fight infection. It's actually amazing because this coronavirus is something new. The human body can produce something to fight off the virus. But it only happens after someone has been infected with the virus. So what would the antibody testing tell us? I'll let Dr. Kitchen and Dr. Ruiz explain to you why it's important for medical providers. But for policymakers, we need to know virus exhibit little or no symptoms, but it is important to determine the extent to which the virus spread in the community. Can we see the next slide, please? The antibody testing, again, tells you whether or not you have had the virus. Here is some information, and I can only imagine what reasons some people have for not being tested. I understand if someone has tested positive. Why should I have the antibody test? I know I've already had it. Because we are looking for a representative sample. The people who have tested need to go down and be included in the number of individuals who are tested. What is important about a representative sample? I'll tell you. We know the zip code which has been most heavily impacted by this virus is 31701. The coroner has pointed that out week in, week out. Well, of the 562 people who have been tested for antibodies as of yesterday, let me say 331 of those were employees of the Dougherty County school system who were encouraged by the employer to go down and get tested, which means we have only 231 citizens in Dougherty County who have been tested for the antibodies at the site at the Civic Center. The city, county, and school board incurred substantial expense. Augusta University has professionals who have come down here. Augusta University was particularly interested in coming to Dougherty County because of the high rate of infection we had in March and April. We need to take advantage of this. Citizens, I am asking, please, and we'll have the number here in a minute, please call 31701 of the 231 citizens who are not employed by the Dougherty County school system. Only 46 have been tested for the antibodies. Likewise, 31705, the number is the same, only 46. As you would expect, the zip code which has been least impacted, 31721, has the most people who have been tested for the antibodies at 73. 31707, just to complete that, 66. What we need to do as a community, please, can we see the next slide? All you have to do is call this number, 706-721-4905. I implore you, please, make an appointment, be tested, you'll be notified of the response. What does it matter if I've had the antibodies? It is important for you to know, but again, it is also important, and I'll let Dr. Ruiz and Dr. Kitchen explain this in a minute, for policymakers to address this situation in the event of a second surge. Now, we know that one local medical practice is conducting antibody testing, and I have talked to representatives of that practice and am advised that the antibody rate is about 7%. I think that is going to be terribly unrepresentative of the community, and it probably is a situation. This antibody testing is being conducted on people, and they're paying for the service. We need a representative sample, and that's what Augusta University has to have. What do you mean by that? Well, if this community is 70% African American, to really know what the infection rate is of the people who are tested, we're going to have 70% African American. We also had to have the age discrepancy. Age, we can't just test people who are under the age of 40. That would not be representative. The second issue, and I'll talk briefly about this, I want to encourage the public to have the flu vaccine. I have looked at some articles in preparation of today. Medical providers throughout the world said we now have two pandemics coming at the same time. There's the possibility that healthcare system will be overwhelmed if flu infections are not contained in the coming fall. What do you mean by that? Well, coronavirus spreads, and the flu, they spread more efficiently when people are in close contact with each other indoors. The symptoms are very much the same. Now, we know that influenza presents the most severe problems among elderly people with underlying health conditions. The same is true of COVID. What we also know is flu impacts those members of our community, people of color, at higher rates. What we have control over, we do have one vaccine. We have a vaccine for the flu. And I would ask, encourage, implore citizens, particularly first, those who are 65 and older and have underlying health conditions, to have the flu vaccine early this year. One study showing that flu numbers are down dramatically this year. And why is that? Because the precautions we are taking to protect ourselves and others, wearing masks, maintaining social distancing, hand washing, are also efficient in combating the flu. Now, there's a study, I won't go into it because there's only 58 people between January and April of last year in the United Kingdom who had both COVID and influenza. Now, these people were all in the hospital, so you know they were seriously ill. But the rate of death was approximately twice for people who had both viruses as opposed to people who had only COVID. So there's no question that what we have surmised, heard and surmised in the past few weeks is true, and that is the possibility of a very unfortunate outcome is much greater if an individual has both the flu and COVID, and particularly those who are most susceptible. We know who that is, people who are 65 and older and have serious underlying medical conditions. So let me, in closing, ask you to please do your part in helping us fight COVID. Call this number, 706-721-4905, and make an appointment to have the antibody testing. We only have this opportunity until the close of business next Tuesday, so you need to act promptly. And secondly, I want to encourage everyone to have the flu vaccine so that you can protect yourself from the possible fallout of having both COVID and influenza this fall. Thank you.
Thank you, Mr. Mayor, for your comments this morning. Now we'd like to hear from our representative from Phoebe Putnam Memorial Hospital, the Chief Medical Officer, Dr. Stephen Kitchen. Dr. Kitchen?
Thanks, Chief. And I'm going to begin by giving a summary in terms of what our current activity is related to COVID at Phoebe Putney, and then I'm going to spend a little bit of time speaking about antibody testing and why it can be so helpful, important information, and I think some very promising aspects of antibody testing and how it can be used, and lastly, spend a little bit of time talking about the upcoming influenza season as well. So I've got some pretty, I think, promising or encouraging news to share with you today in terms of what we have observed regarding our COVID activity at Phoebe Putney and in the community at large. So currently, as of today, we have 32 patients who are hospitalized with COVID-19 at Phoebe Putney Memorial Hospital in Albany. That's certainly down from what it was a week ago when we were in the low 40s, and significantly reduced to where we were a month or so ago when our numbers were running in the mid 60s to low 70s at that time. And again, you know, I think this is a reflection of the community response in terms of taking those very effective measures with regards to wearing a mask, social or physical distancing, hand hygiene, and avoiding large groups. Of that 32, roughly 1/3 of those patients are in our intensive care units, and the other 2/3 are on the general medical units. And again, the majority of those patients are at Phoebe North. So we certainly hope that this trend will continue going forward at this point. And realistically, what I think we can expect is there are going to continue to be some fluctuations in those numbers. And so I think we can expect realistically those numbers will rise, but certainly, hopefully, nothing that would approach the impact that it had on our community several months ago. I'm going to spend a little bit of time, I think, further addressing some of the questions around antibody testing that Mayor Dura just spoke to. So I think, you know, when our body is exposed to some type of infection, whether it be a bacterial infection or a viral infection such as COVID-19 or the flu, the vast majority of the time, the body will respond to that with what we call an immune response. One component of that immune response is that our immune system will produce a protein called an antibody. And really what an antibody is, it will basically respond to the bacterial or viral or fungal infection and help the body fight that infection. That's what we refer to as natural immunity. And fortunately, most of the time, some type of a response will occur. Doesn't occur all the time, but it certainly occurs the vast majority of the time. And many of these antibodies are what we call protective antibodies, meaning that they will help the body fight and clear the infection as it occurs. So I think antibody testing can be important for a variety of reasons. It can certainly give us very helpful information or kind of a window into what the prevalence of that infection is in our community. To Mayor Dura's point, some people have very mild or no symptoms at all, and they may not ever know they were exposed or were exposed to the virus or had what we call an asymptomatic infection unless they have an antibody test done. I think one really important aspect of this, we've talked about the fact that there's not been a silver bullet for treatment for COVID-19. And ultimately, our best hope lies with a vaccine to prevent people from becoming infected with COVID-19. But I think there is a very promising treatment, and although our experience with this is still relatively early, the data thus far is very promising with treating patients who are infected with COVID-19 with what is called convalescent plasma. And what convalescent plasma is, with people that we know have had the infection and have produced antibodies, those antibodies can help other patients infected with COVID-19 fight off the infection. There was an ongoing study done through the Mayo Clinic with convalescent plasma that showed very promising results. And when I talk about very promising results, what I'm saying is that patients who were hospitalized and seriously ill with COVID-19, when they received convalescent plasma from a donor, they had a very, very favorable response to that. And although the data is still very preliminary at this point, it looks like probably around 70% of patients who are hospitalized and seriously ill with COVID-19 will have somewhat of a clinical response if they receive convalescent plasma, meaning that convalescent plasma will help them fight off the infection better than if they had not received it at all. So, for the individuals in our community who, have unfortunately been infected with COVID-19, if you're looking for an opportunity to give back and help people who are currently infected with COVID-19, one way to do so is to, if you have antibodies to COVID-19, to participate in giving, in donating plasma. I wish I could tell you that we had a local plasma donation site in Albany, which is done through the Red Cross. Unfortunately, we do not. The closest Red Cross donation center is in Valdosta, but I would bring that to your attention and make you aware of the fact that is an opportunity to give back. And what I will tell you currently, we do have a process in place at Phoebe Putney to administer convalescent plasma to patients who are infected and hospitalized. And although the results are still very early and preliminary, our physicians, our doctors are giving me the feedback they do think that it has a role and that the vast majority of patients do improve or have a clinical response when they receive convalescent plasma. Lastly, I do want to spend a little bit of time talking about the flu season, the influenza season that is really quickly approaching upon us. We have already seen a small number of patients who are presenting and testing positive for the flu, but generally our flu season will really begin to peak late fall going into the winter. So, usually by November, the number of cases of flu that we see will begin to rise dramatically at that time. And as opposed to COVID-19, with the flu, with influenza, we have a very, very effective and safe preventive strategy at our fingertips. The single most effective thing that anyone can do to prevent getting the flu is to get a flu shot, is to receive the flu vaccine. The flu vaccine is now becoming readily available. It's already available in some of the local drugstores and should be, if it's not currently available, should be available within the next week or so in most primary care offices as well. So again, I think we have the opportunity to dramatically impact the number of flu cases that we see, and again, the population that is most vulnerable to becoming seriously ill with the flu is the same population that is most at risk and vulnerable to contracting COVID-19 as well. And, I think we need to acknowledge the reality before us. And I think we all appreciate the fact that COVID-19, not just locally, but statewide, nationally, and internationally, has severely taxed the resources of the healthcare system in terms of the number of hospital beds, the number of ventilators, and simply the number of doctors and nurses that are available to treat COVID-19. If we have a really bad flu season and you put that on top of, you superimpose that on top of a global pandemic, I have serious concerns about the ability of the healthcare system to meet that demand. And that's a position that none of us ever want to be in. And I think similar to COVID-19, influenza manifests itself as in respiratory disease and respiratory symptoms. And, I think if you take someone who's already seriously ill with COVID-19, if they contract the flu on top of that, unfortunately, I think that the clinical outcomes, the mortality rate, all that, I think are going to be certainly much, much worse than what we see with COVID-19 alone. So again, I would really like to appeal to everyone to be very, very proactive. I think we certainly have a golden opportunity before us in certainly the remainder of the month of September and the month of October to really, really encourage everyone to go out and receive the flu vaccine. So thank you again for your time today.
Thank you, Dr. Kitchen. We appreciate your presence today. We will now have our public health update, And we'll hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Ruiz.
Thank you, Chief, and good morning, everyone. Sometimes I'll be talking with someone from the community, and a person will ask me, how's the COVID infection problem going? And I don't usually have a quick answer for them because I like to be honest and complete if I can. And so I usually start my answer by saying, well, it depends. And I think it does depend, because in many ways the COVID pandemic is considerably better than it was months ago. Most of us are better off in many ways than we were. But then again, some people are not. Some people are sick today because of COVID-19. And if we're not careful, many more will be sick in the days to come. So I think it's a good idea to have a balanced approach. We can look at the good news, and there is good news, and we could even celebrate it. But it's important that we also maintain a realistic perspective and always remember that this problem is not yet over. But let's talk about some of the good news for just a moment. One thing is, if you look at the number of infections that we have had in Dougherty County, you might say we've had two peaks. The first one occurred in the last week of March, and then the second one occurred in the second week of July. Since July, the number of COVID infections on a daily basis has just been steadily going down. And that's really good news. That's a trend that we can celebrate. We want to continue to see that trend go on down. Another thing that we can look at is the positivity test rate. And so what we mean by that is in public health, we gather the results of all COVID tests that are done, and that's done on a county-by-county basis. So in Dougherty County, public health pretty much has the numbers. We know how many tests have been done, and we know how many of those are positive. So back in the worst parts of the pandemic, the rate of positive tests was above 20% for a considerable amount of time. But here lately, it came down below 10%, and lately it's been below 5%. And that's a really good accomplishment. It's generally thought that when communities have a positivity test rate of below 5%, that's a sign of an improving community. It's a place where it's probably safe to get out when you're using precaution like exercising, social distancing, staying 6 feet apart, and wearing masks. That's a good sign. It's a suggestion, at least, that children going back to school can do so successfully and safely. So that's a really good benchmark. It's also worth celebrating that in general, medical knowledge about COVID-19 has been increasing. And it's also a great thing that Dougherty County has this opportunity to participate in the antibody study so that the knowledge about this community can increase in ways that can help those of us in the medical and scientific community to feel like we know more about this community, where it's been and where it's going. It's a great opportunity, and it's not available for all communities. So it's here, and the resources have been committed. It's a great opportunity, and speaking for public health, we would urge citizens of Dougherty County to take advantage of this great opportunity. There's also hope for a vaccine that's coming. So these are just a few of the things that we would all consider as good news, things that are worth celebrating. On the other hand, it would be a mistake if we were to take a position that all is well and the threat is gone. Nothing could be further from the truth. We should remember that we are still in a pandemic. It's a deadly pandemic. People are still getting sick. People are still being hospitalized, and people are still dying from COVID-19. We don't have the magic bullet yet, and it may sound a little bit boring, but the truth is there are things that we can all do to help reduce the spread of COVID-19, and you've heard them before, but it includes things like social distancing, stay 6 feet apart from other people whenever possible, wear a mask or a facial cover when you're out in public, try to keep your hands clean, try to sanitize and disinfect commonly touched surfaces, and by all means, if you're sick with symptoms that are compatible with COVID-19, please stay at home, consult your medical provider, and consider getting tested. And I'd like to echo some of the things that have already been said before. Flu season is here. It's nowhere near its peak at this point, but the peak is coming. And it's very important that we always get vaccinated for influenza, but it's especially important this year because of what's been said already. If we get sick with the flu, our life is in danger. If we get sick from COVID, our life is in danger. And if both of those infections occur at once, the chance of a bad outcome is really multiplied. And I agree with Dr. Kitchen also that an influenza pandemic can really stretch the ability of the medical community to respond. COVID by itself can stretch that ability. And if we have a surge of both of those infections at some point in the late fall or winter or any time really, that's going to be a very scary situation. So as individuals, we can do a lot to help ourselves by getting a flu shot. We can help our community also by getting a flu shot. And considering the possibility that a vaccine for COVID might be available in the next few months, we want to be able to turn all of our resources in that direction to immunizing the community for against COVID-19. So we would like to be done with flu vaccinations as soon as possible this year. We'd like to set a goal of having everyone immunized by November, and that would free up our resources to administer the COVID-19 vaccine if it comes along. Getting a flu shot has never been easier than it is now. We would love it if you get your flu vaccination through the health department, but that's not necessary. The main thing is that you get vaccinated. There are many choices: doctor's offices, clinics, drugstores, the health department, many places you can go and get a vaccine. And it's also true that almost every third-party payer, private insurance, group insurance, Medicare, Medicaid, they usually will pay the entire cost. In public health, if you don't have a third party, and if you can't afford the flu shot, we will work with you. There's no financial barrier to getting a flu shot. We work with schools. We make flu shots available in all of the schools throughout Southwest Georgia. And we also don't require an appointment. You can go to Daugherty County Health Department and get a flu shot Monday through Friday without an appointment. And for the most part, that's true in every health department throughout Southwest Georgia. In some of our health departments, we are spending a good bit of time collecting specimens for COVID-19 testing. So on those days, it may be a little difficult to just walk into the health department and get a flu shot when many of the resources are dedicated already for COVID-19 testing. So it might be a good idea to call ahead just to make sure that it's okay. We also, in Daugherty County, would like for everyone to understand that the Daugherty County Health Department can and will mobilize and go and provide flu shots for businesses and other organizations. We do ask that there would be a minimum of 20 people getting the flu shot for these types of events. So if you are part of a business or another organization, and if you're interested in this, please call the Daugherty County Health Department. The number is 229-638-6424, and you could ask for the county nurse manager, Vamela Lovett or Beverly Reed, and they can talk to you about trying to set something up for your business or organization. And then the last remarks I'd like to make are about the testing. And testing for COVID-19, again, is an easy thing to do. In Southwest Georgia, an appointment can be made in one of two ways, and they're both easy. A telephone call can be made at 229-352-6567. That line is open all day, Monday through Friday, and Saturday mornings. You can call that number and set up an appointment. The testing for COVID-19 is free. Another easy way to do it is to go online, go to covid19.dph.ga.gov. You can do that 24 hours a day, 7 days a week. You can see what appointments are available. You can see the locations and the timing, and you can select what works best for you. If you have your COVID test through Public Health in Southwest Georgia, you can have access to your own result just as quickly as we can. You can find out what your test result is by going online, and generally that result is available within 24 hours. So there are things about this pandemic that we can celebrate, but the fight is not over. We're still in the midst of a pandemic. Do what you can to protect yourself and to protect your community. Thank you.
Thank you, Dr. Ruiz, for your comments today. Next, we'll hear updates from Dougherty County Coroner, Mr. Michael Fowler.
Good morning. I want to say I have some positive news at this present time. The death rate has slowed down tremendously in Dougherty County. As of today, we have 183 deaths that have been reported from the COVID-19. There's only 3 deaths since the last meeting that we had. September has been the lowest death month since we started back in March. And like I said, I hope we get to the point that I won't have to come up here anymore, saying because we don't have any more death. But the only way it's going to happen is everybody keep doing what we've been told to do. So this is a short presentation, 183 deaths that have been reported here in Dougherty County residents. And I want to encourage you, don't forget the 2020 census, and also don't forget the antibiotic tests that the mayor, Dr. Kitchens, and Dr. Ruiz have spoke on. They're going to be very important. They are here from Augusta to help us, so please go and get that test done. Again, like I said, 183. 1 death is too many, but still, we have come a long ways compared to what 1 month we had 86, and now we're down to like 3 deaths for the month of September. I think we've come a long way. Again, thank you.
Thank you, Mr. Fowler, for your remarks today. We'll now hear from the Dougherty County School System. Ms. Lakeisha Bryant Bruce is the Director of Community Relations. Ms. Bruce?
Thank you, Chief. On behalf of Superintendent Kenneth Dyer and our board members, I'd like to take this opportunity to share an update. Our responsible restart plan has always been balanced with our strong desire to return to in-person, on-campus instruction, with our mandate and responsibility to keep our students and employees safe. We were always aware of what it was going to take to reopen our schools, and we use data and science to inform our planning and decision-making. We are excited to now prepare for the first group of students to return to their schools next week. Grades pre-K through 2 will begin on Monday, September 28th. Grades 3 through 5 will begin on Monday, October 5th. We have not set a restart date at this time for middle and high school students. Let me emphasize, the only students that will be returning on Monday are those students that schools have spoken to parents and confirmed your choice of returning to on-campus instruction. If you have not spoken with anyone from the school about this confirmation, your student should remain in online learning at this time. I also want to provide clarity and avoid any misinformation about our restart plans. Sending your students back for on-campus, in-person instruction is not mandatory. Parents have a choice in the instructional model that they select for their students. From the beginning, our plan was designed with safety and flexibility in mind. Therefore, if you believe that virtual instruction is the best fit for your student, or you are not comfortable sending your students back to on-campus instruction, please feel free to continue in the virtual instruction model. For students returning to the building next week, masks are required on the bus and in the classroom. Again, masks are required on the bus and in the classroom. The only exception is if a student has a medical documented case by a physician as to why they cannot wear a mask. In those cases, students will be required to wear a face shield. We will also use 3-sided clear desk shields on each desk in the classroom. The uniform policy for K through 5 will not be enforced this year. Students will have to adhere to a district dress code. That information can be found on our website in the Responsible Restart section. The extended day program will not begin next week. Parents, please provide for after-school care for your students. We will share details in the coming weeks about this year's program. We intend to use a public dashboard on our website that will be updated every Friday to keep the public informed of our cases of students and employees, and how many students or employees may be quarantined at any given time. We will share the link to this dashboard beginning next Friday, October 2nd. Parents will also be notified of cases at their student's school and/or in their student's classroom. All fall sports have resumed practice and are preparing for competition. New COVID-19 safety measures will be enforced during all Dougherty County School System sporting events, including but not limited to those held at Hugh Mills Stadium and Gordon Sports Park. All attendees of our sporting events are required to have their temperature checked, wear masks, and practice social distancing. Again, masks are required at all Dougherty County School System sporting events. There will also be limitations on crowd capacity, so we encourage everyone to purchase your tickets to these events in advance. We have moved forward with implementing a touchless ticketing system, and we will share information on this system and how to purchase tickets no later than Monday. Meal distribution. We have multiple options for meal service and delivery. Any child under the age of 18 is eligible for a meal. Meals are delivered on Sunday and Wednesday afternoons. Students can receive meals for breakfast and lunch on multiple days. All routes with bus stop addresses and times are listed on the website under the Responsible Restart section. Please remember to wear your mask and practice social distancing at the bus stop. Parents can also pick up meals at the cafeteria at 5 schools: Albany Middle, Mary Acres, Dougherty High, Monroe High, and Westover High. The times for meal pickup are Sundays and Wednesdays from 4 to 6 p.m. and Mondays and Thursdays from 10 to 12 p.m. We encourage all parents and guardians of students in the district to please make sure that your contact information is up to date in the parent portal, Infinite Campus. This is the contact data that we will use to continue to share important communication for the school year, and this is also how you review your child's academic progress. As a reminder to the community, starting Monday, school zones are going to be in effect. Make sure you pay attention as you are driving. Slow down and look out for students who may be walking to school. Also, school buses will be running their routes to pick up students across the county. Please be on the lookout and adhere to all school bus safety rules. All of the information shared today can be found on our website, www.docoschools.org. Look for the COVID-19 tab at the top of the page and click the Responsible Restart banner. You can also find this information on our social media pages on Facebook, Twitter, and Instagram. Last, just because our COVID-19 numbers are now lower in Dougherty County, this does not mean that our collective responsibility has ended. Please continue to wear your mask while you are out in public, wash and sanitize your hands, avoid large crowds, and practice social distancing. Thank you very much.
Thank you, Ms. Bruce. We will now pause for any questions that maybe from our media. Okay. If there are no questions today, we'd ask you to please join us for our next press conference. It will be October 9th. We're now meeting every other Friday, so our next press conference will be October 9th at 10 in this room. We'll see you then, and we'll remind everyone to mask up Albany, mask up Dougherty County. Thank you. That concludes our press conference for today.